Hello, everyone. I'm Dr. Ioanna Nixon.
I'm Dr. Vilma Pacheco-Barcia, and this is Open Doors Podcast, two women scientists driven by curiosity, evidence, and compassion.
Welcome back to Open Doors, the podcast where we explore professional well-being in oncology and beyond, one conversation at a time. Today, we're opening the door to a perspective that is powerful, is fresh, and deeply needed. The voice of early career oncologists from emerging and resource-limited settings. How do young oncologists build careers with global impact while navigating structural challenges at home? How do they shape the future of oncology, not later but now?
Today, we're honored to welcome someone who embodies that future, Dr. Imène Hadji, medical oncologist from Annaba, Algeria, and a rising voice in global oncology. Her journey spans continents from Algeria to France, the US, and beyond. Through the Ask Idea Award, the SO College Virtual Mentorship Program, and a clinical observership at the University of Chicago. She is trilingual, multicultural, and committed to equity in cancer care, teaching early detection and strengthening oncology services in resource-limited settings. And she stands at the intersection of many identities: clinician, educator, global citizen, and early career leader. Welcome.
Imène, we are thrilled to have you. Welcome to Open Doors.
Thank you so much, Ioanna and Vilma. What an introduction. Thank you so much. I'm truly grateful to be here with you. Really.
Thank you, Imene. Your path is extraordinary, not just because of what you've accomplished, but how you've done it. What first inspired you to become a medical oncologist in Algeria?
Oh, thank you so much, Vilma. I always wanted, I always knew I wanted to become a doctor. That part was clear early. But the specialty, that changed all the time. And to be honest, medical oncology was never on the list. And there's a simple reason for that is that we didn't have an oncology course in our medical school curriculum back then. Now it is getting there, but back then we didn't have it. So I didn't really know what the field truly was. So when I passed the national residency exam and had to choose a specialty, something my late American mentor, who also was a neurosurgeon and host dad when I did my exchange year abroad, he told me something that came back to my mind at the time, and he told me that like almost 20 years ago. It was on our way to school. I remember that it was in the car, and he said, "Imen, if you really want to get into medicine, before choosing your specialty, choose your professor. That person will either make you like love the field or make you hate it." So that advice stayed with me. And believe it or not, that was one of the main reasons I ended up choosing oncology. He wasn't really happy about it because he wanted me in surgery, because he always said I had the fingers for it. But I met a young female professor in oncology who was incredibly motivated, generous with her time, and deeply committed to her patient. She became a role model for me, and I am truly glad I followed that path. So, very early in my training, I felt that oncology was a place where compassion, and science meet, and that gave me a purpose. So yeah, I think this sums up why I chose it. As for the global outlook, I think it came naturally, because where Algeria sits at the crossroads of Africa and Europe and the Arab world. So, we grew up with multiple identities and influences. So for me, learning never had borders. As a young trainee, I kept looking for knowledge wherever it was being created. And I realized something important. What I bring back home matters as much as what I learn abroad. So that dual, perspective Local roots, global curiosity really shaped who I am today.
Thanks, Imena, and that's great. And in a way, I don't know where to focus because you said so many important things. One of the things I keep and I highlight to everybody who is listening is the importance of the people we come across. You mentioned the professor and the person who inspired you to become an oncologist. So to all the seniors, the mentors, we do play a big role in people's journeys, as I say, the hero's journey, as we say in coaching. So, Imene,
Definitely.
many young oncologists um, would like to have a more global perspective like the one you described and do international work, but very few actually manage to combine the level of training that you had across so many countries and the way that you've crafted it basically. So what drives you to seek training abroad and then bringing it back home, so always coming back home?
Yeah. What really drives me to seek training abroad is that cross-border learning completely transforms the way you think. For me, this started long way before medicine. It began in high school. I was lucky that my parents encouraged me and allowed me to apply for an international exchange program called Nacelle Open Doors. So I was selected and spent a year in the United States and studied in an international school with more than like I think 20 or 26 nationalities. So I was 16, and that experience changed everything for me. I saw that we are all human, all the same in so many ways, but also our differences are actually our biggest sources of learning. Many of the friends I made then are still my friends today. We travel together, we challenge each other, we stay connected. You know, that early exposure shaped the way I approach the world. And fast forward to my career as an oncologist, the same principle applies. You know, when you train in different systems in Africa, Europe, the US, you realize that innovation isn't only about the new drugs, you know, it's about how a service is organized, how teams communicate, how patients are supported, also how time is used, you know, and how the systems think. For me, I seek training abroad because I want to bring those ideas back home, you know, not copy paste them, but adapt them to the Algerian context. Um, I've always felt that my identity is both local and global. I belong to my community in Algeria, and at the same time, I feel deeply connected to the international oncology world. And I feel it like a responsibility. So that dual sense of responsibility to learn, you know, globally and serve locally is what motivates me every time and every single day, you know.
Wonderful, Imene. I think it's beautiful how you have described global oncology. You know, all the challenges might be different depending on your setting, but we have a common goal and it's helping our patient. And cancer patients are unique. They have unique challenges. Every patient is different, every disease is different. But together as a global oncology community, we are able to grow and, as you were saying, Imene, adapt. I want to bridge with all you've explained to us and go back to your country, to Algeria. I want to talk a bit more about what clinicians and how the structural challenges you are finding in your day to day practice from your perspective as a young oncologist. What are the innovations or adaptations that make the biggest difference once you're on the ground?
Right. So, well, in Algeria, you know, the innovations that make the biggest difference are definitely not always high tech. But they are about you know, people. They are often simple and human centered. You have to be, to be smart about those. And one of the most impactful changes has been the simplification of care pathways. When patients know exactly where to go, who to see, and what the next step is, delays decrease dramatically. And, in oncology, time is everything, right? And yeah, so another essential innovation, I think, is building strong partnerships, like with general practitioners, for instance. They are the first point of contact for most people. So empowering them, especially in the early detection of breast or like colorectal or even prostate cancer, has had a huge impact. When primary care becomes part of the oncology ecosystem, you start catching cancers earlier and outcomes shift. And then also there's the community engagement. In countries like ours, trust is the real currency of public health. When people trust the system, screening stops feeling like an event and starts becoming part of everyday life. And that's when change happens. I think in resource limited settings, innovation is often human rather than technological, rooted in organization, communication, and also collaboration. The beauty is it works.
That's amazing, and it truly speaks to my heart. I think Vilma has heard me talking before about humanized innovation that you mentioned is human centric. It's not techie, it's not digital necessarily. It's not about a fancy product that is really promising and requires a lot of money. It's about knowing the people and knowing the system. And you've used a couple of times already in our discussion systems thinking and change, and how important multidisciplinary, intersector, interdisciplinary work is in cancer care and cancer ecosystem. And I do wonder, at that stage in your career, what stemmed this interest? When did you realize that systems are incredibly important, and within these systems, actually, we can transform care for that single unique cancer patient who is a unique individual?
Okay. You mean like the system level thinking, right?
Yeah.
Yes. So yeah, I focus on system level thinking because I realized very early that oncology is so much more than choosing a treatment. It's also about how patients enter the system, how smoothly they move through it, um, i- and whether they feel supported at every step. If any part of that pathway is weak, even the best treatments, won't achieve its full impact. But I'll be honest, this path isn't always easy, As a young oncologist, especially coming from a resource limited setting, imposter syndrome can hit really hard. Sometimes you walk into an into international rooms, you see what others have accomplished so early in their careers, and you think, am I too late? Am I doing enough? And yet those moments, I do my best to take advantage of these moments, and because they push me to look at what I can change right where I am. Because the truth is, early career clinicians are the closest to reality on the ground. We see the delays, we see the gaps, the barriers patients face. We see where the system sometimes breaks down, and gives us a unique perspective. For me, system level work became a way to turn that feeling of not enough into something constructive. That's what I try to do. I realize that you don't need a title or 20 years of experience to improve the way patients move through care. You just need to start. If we wait until we feel experienced enough, we lose years during which maybe hundreds or thousands of patients could have benefited. So, yeah, even with the doubts, even with imposter syndrome, I remind myself that change doesn't have to start big, but it has to start early. And that's why I'm committed to it now.
Wow, Imene, all you've said resonates so much. Well, you know, I'm a researcher, and when I was younger, when I was a resident, I remember once I've talked about this with Ioanna before. I remember there were moments I thought everything was like a huge mountain. I just wanted to do so many changes, you know, for the good of the patient. We just want biomarkers. We just want innovation. We want liquid biopsy. We want it all, you know. And it's true that through time, you also learn how important it is every small change. And something I say a lot to my friends, and something actually it's in my WhatsApp, you know, like the your quote, it's big change comes from small, steady steps. So I would like to congratulate you, Imene, for all your work. I think it's wonderful how you're trying to change small with small steps all that you have on the ground. So I think it's brilliant. Really, congratulations on that.
Thank you so much. Trying, doing my best.
You are. And
You are?
Imene, yes. Here we spoke on the last episode with Dr. Yago Garitora India. He's a fellow. He's in Denmark, and something we spoke about was how you might not feel at home when you're outside of home. This is important because you were actually explaining earlier how you went abroad and you did some programs and you um, have developed new friendships. And always in that, we have the language barrier. You speak French, English, Arabic, Berber, and you're learning Spanish and German. What Joanna and I spoke about in the last episode was how language can shape also your emotions, your colleagues, your friends when you're out of your hometown. So we wanted to ask you, how has your multilingual and multicultural identity shaped the way you practice oncology?
Okay, estoy aprendiendo alemán ahora, pero el español lo aprendí hace 20 años. I just need to practice. um, but yeah, learning languages has always been one of my passions. Ever since I was a little kid, I even forced my dad to teach me how to read Russian when I was young, and hopefully one day I'll actually learn to speak it too. For me, languages have always been a bridge, a way to step into other cultures and see the world through a different lens. In oncology, that matters enormously. Speaking several languages allows you to meet patients where they are, not only medically, but also emotionally and culturally. The way we explain, the diagnosis, the words we choose, the tone we use, these can completely change a patient's experience of their illness. And so being multilingual helps me build trust faster. I mean, it helps anybody who is multilingual to build that trust faster, especially in moments when people are afraid or overwhelmed. And beyond clinical practice, it makes international collaboration feel natural when you shift between cultures every day. You develop cultural humility, flexibility also, and genuine curiosity about others. Qualities that I believe strengthen global oncology partnerships. So, yeah, for me, language is not just communication. I think language is a tool for equity, a way to make care more human, more accessible, and also more connected to the person that is in front of us.
Lovely, man, and I completely resonate as someone who I was born in Greece, and I live in the UK, in Scotland, and I speak three languages myself. And I think it goes beyond communication. It enables people when they're exposed in different environments. And yes, you mentioned imposter syndrome, so that gives me permission to speak about vulnerability. When you are actually building a life, irrespective of how long you're going to stay there, it might be a fellowship, it might be a few years, or it might be many years, it might be your whole life, who knows? But during these times, especially when you start, there are so many unknowns. You have to blend in, you have to adapt, and you have to develop these qualities that you mentioned and speak the language, obviously. And I do think these skills are transferable because in cancer, it's so sensitive. We deal with people who are truly vulnerable. They are battling a disease that is life threatening, and we have to support them and very quickly build rapport. So I can fully resonate with what you said, which brings me nicely to a topic that we are very passionate about, and that is the way we communicate beyond words, beyond language barriers. We talk about precision drugs, precision oncology, how precise we are in terms of understanding the tumor. But how do we communicate with each other and with the patients and the carers? Do you think that people like yourself, young oncologists that have got this broad perspective, having traveled around the world and seen different things, can help us reshape global oncology partnerships and the way we view the profession?
Absolutely, yes. One thing I've observed in international meetings is that even among highly accomplished people, prejudices, biases can still exist. Sometimes people make assumptions about you based on where you come from or what your system looks like before they even give you a chance to speak. That's a reality. And that's exactly why multicultural young oncologists can reshape global oncology partnerships. When you grow up navigating different cultures, languages, and ways of thinking, you will learn how to bridge worlds. You know how to listen deeply, how to adapt, how to negotiate differences, and how to create a safe and respectful space for collaboration. That's a form of leadership. Yeah, representation truly matters. When early career oncologists from diverse backgrounds sit at the table, like we did at the IDEA program, global oncology becomes more grounded in reality, more inclusive, and also more aware of the constraints and strengths of different regions, and ultimately more aligned with what patients around the world actually need. So, yeah, young multicultural oncologists bring perspective, humility, and connection. And I think that combination can transform how we work together